Hello, Ryan.
Hey, Tom. Good to see you.
How you doing?
Super duper.
Wasn't this a fantastic conference?
Best one yet.
It was. I've met with so many cool people like yourself.
Thank you.
What about this event? What do you think has been neat?
I think that, as kind of the COVID moment tapers a bit, we're not forgetting the injured, don't get me wrong. There are a lot of people that need help. But we're in this wonderful opportunity at a crossroads in medicine where we have opportunity in the administration.
Right.
We have
with RFK.
With RFK, Jay Bhattacharya, and the knowledge shared and the breadth of the conference. It keeps growing, the family keeps growing. The whole construct of honest medicine has been missing for so many years.
Yeah.
And just having this very dedicated group to improving the health of humanity from a true heart empathy point of view,
right.
a Hippocratic Oath point of view.
Right.
I mean,
and
just gratitude to be involved with a group like this.
Yeah, and not trying to push, here's one drug for this week,
right.
Here's the next drug for that.
Yeah, a pill for every ill, no. And exploring well beyond, those realms of, I don't want to say traditional medicine, it's not traditional, but captured medicine.
Right.
And so, like near infrared light. Come on. I'm a huge advocate of, what you've developed and what you're doing. I personally use it. I have spread the word.
So what do you use it for?
Well, if aches and pains on my farm, my lecture I just gave, if my back is a little sore from, lifting too many hay bales and this, that, and the other, gosh, I put my light on that area, 15, 20 minutes later, I'm like, this stuff works.
Yeah, and you're also using the transcranial approach with the palm.
Yeah, I'll use the palm to stimulate certain, I know my neuroanatomy really well, so if I'm going to give a presentation, I'll put it on Broca's area for the expressive capture of words.
And it's on the left-hand side.
Left-hand side, parietal, middle strip area.
I'm going to start trying that because sometimes I get a little tossed up on words.
And then even digging into the literature. So a neurosurgeon that I know who was here, she has a patient with new onset seizures. And I said, let me send you some papers on near infrared light therapy and seizure foci. And sure enough, she's like, oh my goodness, why did I never know this?
Well, seizures, I have a fellow who had 2.5 years, he had seizures. Mm-hmm. He got PBM treatment done at one of the universities, Buffalo University, and totally cleaned up his seizures he had about a month or 2 months, I can't remember it right now, but of treatment, and no more seizures.
Right, because he
for 2 years.
regrew his mitochondria and those neurons.
Well, he still wasn't perfect though, because about 2 years later, he had another multiple seizers, and because of COVID, the university
wouldn't let him get the treatment.
Wouldn't let him get the treatment, and so the professor said, "Look, just get a hold of Tom, get one of his lights." So he called me. He said, "What is this thing? Somehow it's supposed to do something." I says, "Well, yes." So he did 1 minute, 3 minutes on the area where they figured the lesion was, and he was seizure free for 2.5 years.
Fantastic.
And no other, and what was funny though, you'll laugh at this, is he had very thin hair up in this area, and he grew a patch where he was grew a patch of hair where he was treating.
Absolutely.
Yeah.
And a lot of people don't realize that.
Yeah.
That it's one of the benefits.
Yeah. There's a lot of stuff that you can buy on Amazon, but there's a difference.
The milliwatts of energy per square centimeter of area is what matters most. There is a lot of junk out there. And you're getting low dose light, but if you want the benefit and the effect,
you gotta
have concentrated light. If you
just want to get rid of wrinkles, go ahead.
Whatever.
But if you want deeper stuff,
want light, are you going to choose the sunshine or a 20-watt light bulb? You're going to choose the sunshine.
Right.
And this is, the engineering. I have a background in aeronautical engineering, Air Force Academy, blah blah blah.
And first you thought my light was kind of weird.
Thermodynamics and I met you a couple years ago.
Yeah.
I had torn a tendon in my bicep throwing hay on the farm, and I had gone to my PT, said it's going to be 2 times a week for the next 4 months. Well, I was traveling and lecturing a lot. I'm like, how am I going to do this? You happen to have a device with
Toronto.
you. Yeah, I was lecturing in Toronto, and you said, hey, I've got a beta device out in my car, let me go grab it. While we were chatting, my range of motion improved by like 60% just in that first 20 minutes.
Yeah.
4 weeks later, not 4 months later, I was better.
Yeah.
4 weeks of light, not 4 months.
So this would not be hard
of
for you to
PT.
believe. I had one kid
Oh,
that
I'm a
did.
doubting Thomas about everything in life, and at first I'm like, nah,
That's not going to do anything.
And then I did the science dive, and you know me, I'm a nerd,
Yeah.
and I'm like, oh, gosh, there's mechanisms behind this. There's actually data behind this. There are fantastic case series behind this. And now, the more, 2 years later, I use red light for many things.
And it also
Or
can,
near infrared light, sorry.
Yes,
Thank
I'm
you.
correcting you.
Yes.
Yeah. And near infrared is the.
And the wrinkles, gosh, I tell people I don't look too bad for 95, do
Oh,
I?
yeah,
No, just kidding.
No, but you have no problem believing that a kid that took a pickaxe, swung the pickaxe, cut the front tendon right through. They said to him normal, regeneration 6 to 9 months before he'd be walking. He did it daily, and we got him in 3 weeks. He's moving his foot this way and that way, but not the full
Right,
deflection,
sure.
but the swelling had come way down.
Well,
and then we got a video of him walking in the parking lot at 1 month.
Wow. I have a friend that came to visit. She was visiting her surgeon. She had fallen out of a tree a couple of years ago, had already had 2 surgeries, was there for evaluation for a 3rd surgery because she still had chronic pain. And I had the device. I said, sit here, I'm going to go run to my bedroom, grab it. I said, while we're chatting, 20 minutes. She's like, this is the first time in 3 years I haven't had pain. And then she called you and ordered a device.
Oh, is that okay?
And she ended up, but here's the good news, she didn't have a 3rd surgery.
Yeah. So we on the way here, I missed my flight because we ended up treating somebody for, we have a helmet that, you know about, that we can go deep into the brain.
Yes.
And do all sorts of cognitive problems.
And there's so many benefits.
And inflammation reduction is, we are the new Ghostbusters, but we're the inflammation busters. And when you can reduce inflammation in the brain, it's amazing.
The brain,
what kind of diseases are related to inflammation in the brain?
Alzheimer's, ALS, strokes,
concussions,
infectious diseases, traumatic brain injuries, yes.
And I had Steve Kirsch had a panel on about 2 weeks ago on autism, and I don't know this stuff. I understand
but
electronic.
It's a great study to do.
Yeah, we need to do a study on this, but he had a whole panel of people, and I did a super chat. I says, is there any relationship between inflammation and autism? And it's like the whole panel lit up. You know?
And near-infrared light turns off some of the inflammatory factors, NF-kappa beta, tumor necrosis factor, interleukin-10, one of the cytokines, and then it tunes down the activity of the inflammation.
Yeah.
And then even, there are...
And lymphatic drainage then.
Yeah, it opens up flow. And in the brain, you have a unique system called the glymphatic system.
Yeah.
But opening up the vasculature for flow and flushing out, with the effect of the light, increasing the blood flow to the areas, you're flushing out a lot of those inflammatory markers.
Ryan, I want to thank you so much for coming on. Thank you for taking that first belief that maybe this light, I should try it on my shoulder. And you did, and this has been now a couple of years.
It's been a great journey together.
Yeah, and it's only started.
Amen.
All the best.